How will Joe Biden handle COVID-19 differently?
I think we're going to see a much stronger coordinated federal effort to roll out some of these critical public health efforts that have really fallen to our state and local health officials. And that is going to be a huge change. I mean, I think when President-elect Biden rolled out his plan the other evening in his speech, everyone was excited. We're excited to see that coordinated response from testing to vaccine increases and strategies for supplements as well. All of it will go towards an umbrella response that we haven't really yet seen from the Trump administration.
How much more quickly can vaccines actually get rolled out? Does it need to be at a much more local level? Is it pharmacies, Lauren, or is it troops?
I think there's a lot of looking into what is causing the delays right now, which is really important. There's two sides. There's the distribution side and getting the vaccine into people's arms. And then there is making sure that people are there and willing and ready to receive it. And so there's a lot of work that has to be done still within the community on trusting the vaccine, on being willing to get it. And then we also need to think about how do we safely and effectively give vaccine? We won't immediately have immunity when you get that vaccine. So you need to create a safe space where you can move large numbers of people through a vaccine distribution center. And I think there's a big push by the Biden administration to do this. That first 100 days or where he's really looking to scale up the vaccine response will be huge. So that may mean bringing troops in to support the actual administration. It may mean bringing healthcare workers into large administration centers like we're seeing being built across the country. But all of it means a concerted effort from the federal government, which is going to be hugely important to support our state and local responses.
Lauren, who's best placed to actually convince people that the vaccine is safe?
I think what I would like to see is a return to these trusted public health entities. So in particular, the CDC, seeing more of Dr. Fauci again, seeing more of those NIH scientists who did so much work to get these vaccines ready to go and in place in such an incredibly short timeline. So scientists, I think we all want to hear more from, but also public leaders, whether that's faith-based, community-based, people who are important to local communities, who understand the concerns, understand the underlying challenges of rebuilding that trust that may not be there right now. So I think we're going to need to see a coordinated effort from all parts of society to say these vaccines are safe, they're effective, and they're an important step on the road to our recovery.
Lauren, here in the UK, the government has basically decided that it's better that more people get the first vaccine, even if there's a delay in getting the second shot. Do we have proof that that is okay?
I wouldn't say we have proof. I think there's a lot of people working on the science behind that delay, or the science behind skipping the second shot while we roll out the first shot to more people. The trials that were done were very specific and a very focused regimen: first shot, certain period of time later, second shot, and then tracking the immune response of the individuals who participated in those trials. That being said, we can infer information based on the results of people who are starting to get that first shot of that vaccine. And I think one of the pieces that we need to focus on is ramping up the capacity to give that first shot, and then making sure that we have the production to ensure that the second shots are available for all those people. So I think right now the priority should be to stick to the regimen, but also think about the logistics of giving more people that first shot, and then planning for the second shot when the time comes.